Thanks for listening to the Pharmacy Podcast Network. Welcome to Executive Dose, the podcast where pharmaceutical leadership meets unfiltered insight. Hosted by Stephen Beckman, CEO of Ural Pharma. Each episode explores the complex forces shaping today's pharmaceutical industry, from global supply chain stress and regulatory shakeups to innovation in branded and generic drug markets. Join us as we engage C-level leaders and decision makers in candid conversations about navigating disruption, driving growth, and preparing for the next era of pharmaceutical transformation. Curiosity leads, strategy follows. This is the Executive Dose.
Leadership under pressure in community pharmacy. You are listening to the next episode of the Executive Dose podcast with our host, Stephen Beckman, back in the PPN studios. Stephen, it's great to see you.
I think I'm going to lead the scorecard for the most visits to the PPN studio network, but that might only be because I live 30 minutes from you. That's probably the reason why.
I think you have the record, although our guest today is creeping up on you because the CEO of Marc Essensa, the CEO of IPC, is with us. He's back. It's so good to see you, Marc.
Okay, hold on now.
Great to see you.
Let's just make sure we're clear here. We're talking about the number of presence in the studio, not the number of podcasts. But anyways, hey, Marc, it's a pleasure to have you here on Executive Dose. Executive Dose is all about opening up the dialogue and discussion around what is really happening between manufacturer to patient. And obviously, in this particular case, we put a very strong focus on the pharmacy and the pharmacy channel because we believe that's where a lot of challenges are currently happening, but also we believe the future looks very bright for pharmacy, and that's one of the reasons why Ural has committed to doing a lot of work in this area to help that. So why don't we start right off with the title that Marc gave us? When you think about what's happening in community pharmacy now, there will be, and there continue to be lots of challenges, but parallel opportunities. So when you think about leadership, what are some of the things that are important for independent pharmacy now to start considering of where they can either advance their leadership or take leadership in a way that will create better opportunity and value for the pharmacy, and then obviously the impact that it will have on patients?
Well, and thanks for having me, Stephen. It's nice to be here with you. And I think a lot of the things that are happening out in community pharmacy is that the one thing that we've had, and this goes right back to the time when community pharmacists were back in pharmacy school, and the reasons why they wanted to go into community pharmacy to begin with, which was to take care of their communities, take care of their patients.
Yep.
I think the one thing that we're finding is that the consistency of independent pharmacy in terms of their service model, how they take care of their communities, and how they engage with patients has effectively continues to win the day in the marketplace and continues to outshine what they're doing over in chains and other mechanisms for people to get their medications, whether that's mail order, direct to consumer. We're still the shining beacon on the hill of the service model. And I think that what we need to do and what community pharmacies need to do within leadership is to remain in that consistency. Why is it that you went into the business to begin with, and remember that? And that's not always easy to do when you have declining reimbursements. You have the IRA drugs creating cash flow issues.
Yep.
Last year was the DIR cliff. There's always something, a left hook, a right hook coming out from the marketplace. And I think that in order to be truly accelerate within this space is that our members at IPC, which are all independent pharmacies and independent pharmacy in general, is having that consistency of service level, consistency of how they run their businesses, and to really take the slings and arrows as they come without necessarily having that impact patient outcomes and patient experiences. So that's the one shining beacon on the hill that we have within our industry. And I think if we can continue down that path with that consistency and with that optimism, I think we're going to continue to fare very well in the marketplace.
Yeah, I think that's a really good point. I think consistency is a word that we could apply about anywhere, and anybody that can do things consistently are going to traditionally be successful. So let's explore that a little bit for a minute, because when I think of consistency, not only as a manufacturer but as a person that goes and actually gets my prescriptions filled at an independent pharmacy, my local one that's just around the corner from me. I've always traditionally looked at that as consistency in terms of them taking the time to do right by the patient, and making sure that their guidance and the information, not only on the drugs but everything else that they're doing, and their ability to get the drugs. But to me, that has been their hallmark. But don't you think that from a consistency standpoint, that's going to have to be expanded? And so as an independent pharmacist, we're going to have to consistently supply new services?
Yes.
On top of that foundation. And if that's the case, where do you think those new opportunities to kind of overlay that consistency mantra will have the best impact for the pharmacy and their community?
And that's a great question. I think when we think of what consistency is moving where the market is going to be and always evolving, right? And I think there's a lot of new and exciting areas that our members are getting into. One is that virtual clinics where you have the ability to have a teledoc service right in your pharmacy, so that way if somebody comes in and needs a refill where they're not able to get in to see their primary care physician within minutes, you can have them with a refill with a teledoc service that is there in your pharmacy with a QR code within minutes. I think that moving into new lines, vaccinations is always a great one. All of our members are now pretty much vaccinating and getting into travel vaccines, certainly the COVID vaccines, as well as anything that's on the federal guidelines as to what you should be at a certain age. That's a great way to continue to evolve your services. And then there's also things such as functional medicine. We have many more of our members getting into functional medicine, which is effectively your high-end vitamins, your supplements, where consumers, as they have the ability to be more educated with and bombarded, even educated with through online presences of what they should be taking, is being able to supply those particular medications and those high-end supplements, and educating our members and educating our patients on those types of things. That's been a really big area of growth as well.
Yeah, I'm very happy to hear that, because over the course of a number of the podcasts we've been asking that question and from different angles and different perspectives. And the one thing that was clear is independent pharmacy has to continue to expand in order to be successful, because unfortunately, as you pointed out, traditional pharmacy still struggles in terms of how many prescriptions they actually lose money on versus they make money on, based on reimbursement and the dynamic of how our system works. But I'm really intrigued by the first. Well, I'm intrigued by all three of the examples you said. But the telehealth. So most people think about telehealth as the lifestyle platforms that are out there and more of these national platforms. But can you talk a little bit more about what's happening, what you're seeing with the telehealth at the pharmacy level? Is this a smaller kind of radius where they're actually linking patients up to physicians within the same community or area, or are they using the larger platforms? And if you saw that continue to grow, it would seem to me it'd be really a great tool when you're able to create a platform where that ability to get to somebody is also somebody that might ultimately be a regional caregiver, or somebody they could potentially even see downstream. So how's that taking shape, and where are the challenges and opportunities with that?
Well, here at IPC, we launched the digital health platform about a year and a half ago. It's called iCare Plus. And what we have is within our pharmacies, as an IPC member, Our digital health network, what happens is if you walk into one of our particular stores, similar to like you would with like a minute clinic or whatnot in a
Yep.
chain, a virtual, there'd be a URL code that if you present yourself 6 o'clock on a Friday, your child's got pink eye, you need a prescription for this, or you need a Z-Pack, or you need whatever. There's a QR code there. You go in, you're able to go into the teledoc service. It's all AI generated. You answer some AI questions.
Yep.
Do you need to see a doctor? And at the end, yes, you see a doctor. And within 3 minutes, as our SLA, a doctor pops up. Okay, they'll go through whatever it is that you need and write that particular prescription. Sometimes it's for pink eye. Sometimes it's, I can't get in to see my primary care physician, but I need a refill and I need this overwritten. Sometimes it might be, I'm going on vacation and I need this particular vaccination, or I need, this particular, nausea drug. Those are the types of things that can happen where it's a cash or insurance-based service. And right there,
that was going to be a big question for me. Well, first of all, if you can turn around something, so these are something a patient can stay in the store and be able to get service properly, and then it is both cash-based and commercial-based. So from a reimbursement standpoint, the system is able to quickly adjudicate that prescription so they could use their commercial coverage as well.
That's exactly right. So both the doctor services can be used in insurance or on a cash pay basis. It's $29 for the outcome, and then of course the prescription is like any other prescription. It goes right into the electronic queue,
so
and right there in the pharmacy you stand there.
Yeah. So if the patient goes into the telehealth, the patient's paying for that, I'm assuming.
The patient is paying for that either $29 cash, or they can also use their insurance for that.
Or their insurance. Okay.
Or their insurance. Yeah. If their insurance takes it, it's Doctronic is our partner on our teledoc service.
Well, I talk about consistency then. If you're able to service your patient at the highest level by operating on that solution, that's a great one. So I think all those ideas are very, very exciting. What's the role not only for pharmacist leadership, and I guess maybe to go back to the leadership question, the pharmacy tech versus pharmacist or pharmacy owner. We've had some really fascinating conversations about the role of pharmacy tech. So when we continue on this dialogue for leadership, how can the different individuals within the setting create value as well? And do you see pharmacy tech able to be maybe traditionally not seen as ability to lead or drive opportunity? Maybe you agree or disagree. I'd be interested in your perspective on, the types of leadership we have to see within the individuals within independent pharmacy.
Well, what's been interesting in talking to many pharmacies as to how they use their staff within their facility, the one untapped leadership entity that's out there are a lot of times are these techs. Some of these techs have got 15, 20 years worth of experience. And what we're starting to see is a lot of pharmacy owners now starting to tap some of these techs with giving them either some type of differential compensation for running specific programs within a pharmacy and having a gain share within that, should they, whether it's on MTMs or it's on vaccinations or whatever it happens to be, is having somebody at that level who shows an aptitude for some leadership or aptitude for some entrepreneurship to go out and lead one of these programs and then gain share back some of the gains from that, and being able to supplement income, because there's only so much you can pay a tech, but certainly being able to enhance it by giving greater responsibilities and giving those people opportunities so that they want to stay with you, because there are opportunities within your pharmacy because you're giving them differentially type programs that they can go ahead and run and manage. And you'd be surprised at the enthusiasm, the leadership, and the joy that a lot of those techs will get out of that.
Yeah, we've had some conversations in our past podcasts, and what we've seen is the one of the challenges has always been is what is the upside to becoming a pharmacy tech? Right. It's not like there's 7 growth positions within a pharmacy tech, but how they can contribute to the generation of patient care, generation of revenue to the pharmacy to make it better, giving them more ownership, more certifications as you expand service platforms within the pharmacy drives directly to that. When you think about leadership, there's a lot of attributes we would assign to leadership, and one is vision. So when you think about IPC, when you think about your pharmacists that you support, where's the next layer of vision to continue to build off that? I mean, the examples you gave earlier were fantastic as ways to expand, but when you look at the next 3 to 5 years, based on what's happening in the marketplace, what's the vision for where you guys need to go?
I believe that what we need to be able to do is continuously educate the value of independent pharmacy as the premier and lowest cost destination to enter the healthcare continuum, right? Mm-hmm. And so what we need to do is all of our members advocating, with lawmakers, both at the state and the federal level, but also effectively demonstrating it in our communities that we have value here by allowing patients to come in and access healthcare at the lowest cost in our community pharmacies, and have that vision that what we don't necessarily need is what we have in the chain environment, where it's a mill that's constantly turning over and handing over prescriptions over the counter, but that's actually being a destination to go in and have these conversations. Part of that is being able to free yourselves up. So a good example of this might be, part of the vision is going to need to be is to taking away the distractions and the workload within the pharmacy that you can, in order to free up your staff to do these higher level functions. A good example of this being the most egregious thing in a pharmacy, if you've spent any time behind the counter, is the telephone. The telephone never ever stops in an independent pharmacy.
That's true.
It is hundreds of calls a day.
That's true.
And so being able to adopt certain things. So we have a new program out. It's a new system that has just come out that's AI based, that goes into your IVR, that will answer your telephone calls at the pharmacy, sound just like a pharmacist. Now, it's obviously AI, but it's a very prompted AI that's very educated and learns as it goes. Where a lot of times a patient will call up and says, "Hello, I need to refill a prescription." "Okay, Mrs. Smith, which prescription would you like to refill?" And then they can't pronounce the drug. Says, "I didn't really get that, but these are the prescriptions that you have on your file. Is this the one you would like?" "Okay, Mrs. Smith, would you like it delivered, or would you like it to pick it up?" Pick it up. All of a sudden, you've advocated and you've eliminated hundreds of phone calls out of the pharmacy, so that way your techs and your pharmacists and your owner can sit down and actually do the MTMs and do the patient counseling. That's just one example that, as a visionary, you have to be able to adopt these new technologies to be able to bring capacity into the store at a reasonable price. So that is something that we have at IPC now. It's up and running. It's in several stores and it works quite well. I have some examples of some folks out in Omaha where they've reduced their telephone calls into the pharmacy by over 80%.
Wow.
And just the frustration of the telephone as a trigger, it's like that Pavlovian dog.
Yeah, absolutely.
You hear that phone ring, it gets the hair in the back of your neck, and just those types of things. The stress level that comes down out of it, and the kind of the joy that comes out of that in the pharmacy. That's just one example, but it's, as pharmacists coming into the future, the vision needs to be adopting new technologies, adopting new ways of doing business, which is that consistency, right? That's what we do. Consistency is being able to innovate over a long period of time as well. And I think that's another thing that we do. And we support that. And those are one of those models that are coming out now that can be really game changing for our members.
Well, there's no doubt that innovation is something that has to be a part of consistency over time. And it's great to hear you say that. And I think your examples reflect that. I want to go back on 2 points, though. The first one is the use of this mechanism, the use of AI, as you just explained through the telephone call. Now, my question to you, as simple as this, is one of the value propositions of consistency and why people come to independent pharmacy versus other options is because they can talk to the pharmacist or to the tech, and that's great when you're in office. But the value is that you feel like you're talking, and there's that close relationship. So, has there been any pushback? I mean, productivity sounds like it's improved fantastic. But what's been the reaction of the patients now? Are they satisfied with that? They still feel that connectivity, I should say, even though it is AI, but they feel good at the end of it because they've got their question answered in an efficient time frame. So is AI really continue to provide productivity at the same time that you're not losing that continuity of consistency of feeling like you're talking to your pharmacist?
So that's a great question. So when it comes to outside providing, whether it's a doctor's office or a nurse who's calling in, right? So not a patient. Yep. It's adopted very well. They love it, the efficiency. They quite honestly, they prefer not to have to talk to somebody if they can self-serve themselves.
I love my pharmacist, but I only want to talk to him when I'm actually in the pharmacy.
Business is business. I need it on, in and out. Now, from a patient standpoint, when it comes to simple things like what's hours of your store open or can I get a refill, the feedback has been very, very good. Now, at any time, you can just say speak to a person, and it'll automatically connect you to a live person in the pharmacy. So there's always that out, and it's quite honestly what we're finding. It's less frustrating than IVR with if you want this, press 1. If you want this, press 2, press 3. Just all voice activated. So actually, we find that rather than the traditional IVR, the AI agent is much more consistent and a lot more user-friendly than a traditional IVR. So actually, we've been finding that it's been a better patient experience rather than a negative of not being able to talk. And for those who, you're a mom, you're busy, you're on the phone, you get the car and the kids in the back, and you want to get a refill, not having to talk to somebody is also a very efficient way to do something. So it's well received.
And the other thing I wanted to dig in just for a moment, and that is your comment about low cost or point of contact. So I want to make sure that we're clear on what you're articulating. Are you articulating that the pharmacy can be that first point of contact where it's not a high copay, or even the case where it's hard to even get into a physician, where if a patient's in need, there's a ability, and that's where your telehealth can also come back in, is that the pharmacist is kind of the pharmacist can play that role as almost triage or that first point of contact for some of the situations a patient's in, versus the ability or the cost to go to the traditional route through a physician. I just want to make sure I'm clear, because I was really I was curious and excited about what you said, because low cost is important, but I also know that the cost pressures on pharmacy make it difficult too. So how's that all work together?
So when I mean the low cost, it's the lowest cost environment. Think of it from the macro healthcare system, where you can go into an emergency room, going to urgent care, going to a primary care physician, or going to an independent pharmacy. It's being able to express as leaders in the community pharmacy space, both at the state and the national level, is that we are the most accessible and the lowest cost platform in order to get things done. So this goes part and parcel into ECAPs, right? Yeah. So ECAPs and being able to dispense and being able to get to the top of your license. If we can all consistently, as an organization and as an industry, consistently show that value proposition to the payers and to the government, we're hoping that as ECAPs, and which sounds optimistic that we may get something in this particular Congress, if it gets attached to one of the CRs or if it gets attached to reconciliation, we may be able to consistently see where we can lower the cost of healthcare overall. Now, that said, that means pharmacies have the ability to pick up this margin flow or these new revenue streams that weren't there before. So it actually enhances the revenue streams back into the pharmacy when you're able to bill on these NPI or bill on these particular billing codes, where they're typically in a Part B or they're in a medical setting, but it's for work that you're doing anyway, but it's work that you're taking off a doctor and being able to bring to a lower cost environment. So we want to be able to show that we're part of the healthcare continuum.
Yeah, I love that. I mean, I think that's fantastic, and thanks for giving some additional clarity to it, because I think that's exactly the role that you can play, and I think it's almost essential, right, in pharmacy. Yeah. If we don't find these platforms to drive some of the at the end of the day, revenue makes the world go round. Whether you're a manufacturer of drugs, whether you're a pharmacist, physician, whoever, we still have to make enough that we can continue to provide and improve. And And the biggest challenge of all the constituencies that we deal with as a manufacturer, from physician to wholesalers, distributors, PBMs, insurance companies, pharmacists, the one that gets beat up the most, I'm being a little biased here, is the manufacturer and the pharmacist.
Yeah. The front and the back.
The front and the back always seems to get beat up pretty good. And look, I don't think anybody would deny that we have a lot of improvements that we need to make in our system, but we have to be able to make the pharmacist profitable and the pharmacy profitable in order for these things to come to fruition, as you said, because then we can start demonstrating through performance that we can manage healthcare in a different way that can be lower cost, as you said. So thanks for doing that. And I think, then that might even bring more light to the traditional dispensing of drugs. And we find a better equilibrium within the system to make sure that everybody's sharing, starting with the patient, but all the way through the value chain, that everybody is participating in that value chain and the appropriate revenue that comes with that, so that we can keep the doors open and we can make the doors when you come in, make the experience even better, as you said. So. Yeah. One of the questions I always ask, because I do represent the manufacturing side. So when you think about leadership and you think about consistency, to kind of play back on what's your perspective on how we as manufacturers can help you as IPC, and then obviously your downstream pharmacies? We pride ourselves at the podcast, but at our organization to listen. And one of the things that we always try to get out of this conversation is dialogues with experts and leaders like yourself to say, what do we have to continue to do to fit into that? Because everything you said, I agree with. Consistency of value, creating more value on all levels from pharmacy down to patient are going to be important. And the question is how do we help in that? How do we help in that cause? Now, obviously, keeping costs on drugs, favorable and things like that. But is there other things that we need to be thinking about from a manufacturer perspective?
So, unfortunately, you're in a very precarious. Now, you, the generic you, in terms of manufacturers,
yes,
on the generic side, are in a very precarious position, because you're having to deal with source programs that have unbelievable market leverage and are constantly going out to RFP, and you're in a space where there's a lot of times an overabundance of capacity. So a lot of times you get beat up in a lot of these RFP processes, and so keeping your costs down, and this is just to be quite frank, keeping your costs down and being able to offer the best prices really doesn't translate into things that happen in the independent pharmacy, because once it goes into a source program, it goes into the supply chain. It's cross-subsidizing brands as part of economic model. It's doing all sorts of things.
The value gets lost in the middle.
You're squashed in the middle, and we're squashed in the middle. But here's where I do believe you have an opportunity. So the one thing is that within the big consortiums and the big wholesalers, sometimes when they do their economic deals where they're cross-subsidized with GCR. And you have, brand cost is predicated on that, but there's still the ability for independent pharmacies outside of their contract, once they've maximized the value out of their primary wholesale contract, is to go to the secondary markets and purchase products out there at a much, much discounted rate. So from a manufacturer standpoint, it's a matter of consistently being able to find those secondary markets where that carve out that comes out of a primary wholesale contract can be used to average costs down at the pharmacy, and being able to help us average costs down the overall market basket of what we're having to dispense at the pharmacy by being able to go out and finding specific molecules at a secondary wholesaler where we're able to get it at an appropriate price. Second thing is that, and this through IPC, but we also have secondary contracts that layer behind the primary source programs. And so being able to participate in our secondary contracts, ours known as Pharmacy Select, or if you're a McKesson member, it's called RTL2 on the contract lead. It's being able to have a backup contract to the source program where, sometimes the primary wholesaler just doesn't have the right horse in the game and they don't have the pricing or source or product availability. That is a great way for you to participate, as well as to help independent pharmacy by being able to be that backup contract So that way we can A, consistently supply to the patient, and B, get it at a fair price in order to be there. So those are two ways I see the manufacturers being able to participate really well. And unfortunately, you're in almost in a worse position than independent pharmacy is when it comes to being able to take your margins and being able to flow that down.
Yeah, I agree with everything you said, and it's great to have somebody like yourself be able to recognize, and that's really the spirit of what this podcast is about, is to kind of make sure that everybody within the value chain knows what the pressure points and the challenges are, because we can all know what ours are, but sometimes we don't always fully appreciate or respect what the truth really is in terms of some of the areas. And I think you're absolutely right with everything you said, and I think good manufacturers look at those opportunities. I think the challenge is to understand which therapeutic areas and which ones are the best to make backup. And part of the backup is, I think, really about products where the pharmacy can still make money on the prescriptions. But then you have to understand how the reimbursement dynamic is really impacting those different products at the pharmacy level. So one of the things I've always encouraged our organization, and I would say this out loud on the podcast, is that manufacturers have to understand down to the product level how products are really being covered, and understand where which products pharmacists don't make any money. And you're right, the good and bad of our industry is that we created a generic industry out of the fact that we didn't want to change some of the other parameters of our branded industry. I mean, I started my career in brands, and our patent laws do not reflect the investment and risk that innovative companies take, and give them an opportunity to recoup that investment and put the product out at a price, because on many times it's 12 years to getting a product approved, and you got 5 years to make back a half of $1 billion in capital costs. So that's what formed it. Now, I don't think generic industry is bad, because I've been on both sides of the fence in my career, but we also kind of overshot our skis a little bit now when you have 17 suppliers of Levo tablets, for example.
Right.
We don't need 17, we need 5, and if we create 5, maybe the 5 would create what should be what I would call the right price, not the best price, which is where our industry has gone, but a right price. And that right price then could be reflected through the value chain properly. So first of all, these are all just amazing topics, Todd, that Marc brought today. I think, the spirit of what we're trying to do here is that collaboration is going to get us to that. What the examples that Marc gave today, for me, really shows is the interdependency of our system, our business. So what I do impacts what pharmacy can do or not do impacts obviously everybody in between, and it does have major pressure points on the front end and the back end. And we need to find ways that all the organizations, and when I say all organizations, everybody from the manufacturing, delivery of drugs down to the dispensing and managing of patients, has to understand that it's a synergistic dynamic, and it has to work well if everybody's going to be able to continue to do what we want to do. We want to continue to invest in new chemical entities. We always want to hopefully see improvement. We want to continue to make products accessible, but right now we're also got to a point where the system forces us to be in the largest drug shortage situation we've ever been in the U.S. So, but ultimately, we have to keep pharmacy doors open. We have to keep pharmacists able and the teams that they have around them to do exactly what Marc said, and that's service that patient in a continuous and a level of continuity that ensures the best outcome as possible. So, as we close up, Todd, anything from your side, or Marc, anything you want to close with? I think at the end of the day, if we got one tidbit, as Marc suggested, that we get out of this, I think the tidbit is continuity and consistency, and then applying all those things that are important, like creativity and commitment to the process. And I think the one thing that Marc said that is going to be important, and I see it firsthand, is that you have to be active. You can't just complain. And that means being active at the political level, at the state or federal, continue to put pressure on to have the conversations and the dialogues that will continue to resonate in a way that will create opportunity and adjustment to things to ultimately drive that improvement. But anything you want to kind of close with, either one of you guys?
Well, I certainly appreciate you taking the time and being with me today. I mean, at the end of the day, the real innovative operators are out there and they're networking, they're listening to PPN, they're doing these types of things where they're educating themselves as to what are your peers doing, what innovative things are happening, what is one thing I could do that I would do that I can bring back to my pharmacy that would make an improvement. That continuous improvement, consistency, I think if we can show that leadership, our industry is going to be very strong. I mean, we've had over the years, a lot of stores starting to close, but the ones that remain, the 18 to 20,000 independents that are still out there are the most resilient of the ones that are still remaining. And if we can always go back to grassroots of what was the reason that you went into business in the first place, and hold on and grasp that forethought as to why you wanted to be this entity out in your community, I think we're going to be a much stronger industry going forward. And I'm very optimistic. IPC grew last year, which is, in terms of our membership, and in environments such as this, we continue to see innovations, and I'm proud to have those pharmacists talk to us on a daily basis as to what they're doing.
Yeah, the thing you said was really insightful too. I mean, at the end of the day, if you find a challenging situation, by definition, the weak will go away. So, and that's not to be critical of those pharmacies that are no longer. But what it really sounds like to me is that we're getting to a point in time here where the independent pharmacy that is in place now, these 18 to 20,000, are getting strong, and they have a strong foundation. And when that strong foundation's in place, that's going to be the example and the enthusiasm for other people to get back into independent pharmacy, to what you said, for why you wanted to do this to begin with. And I'm not a betting man, but I am very optimistic. And I'm not a pharmacist, but I love pharmacists because I believe it's been the channel in my 30 plus years in the industry that we've never honestly given its full fair share as a manufacturing industry. I think that number is going to grow. And you're seeing it because of things like who would thought Rite Aid would have been out of business here. Right. So I think it's great. And, you made a really good comment, and maybe we'll let Todd close here because, PPN is an amazing platform that's been created for this channel, for this community. I've been pleased to be a part of it as a sponsor and manufacturer, and now doing things like the podcast, because it is raising the level of dialogue and discourse to the point where good ideas are being exchanged, but most importantly, to what you said earlier today, Mark, through what you do at IPC, they're actually being implemented, and those trials and errors are going to just make everything stronger. And I'm gonna actually go check my local pharmacist now and see if he's at IPC, and make sure I can go in and get my on-site telehealth there. Yeah, I could use that for a couple ailments from working on my farm. But anyways, Todd, thoughts?
I just am excited. It was great to have you on, Mark. You're the CEO of a company that constantly practices what you preach. Freedom to farm is a whole new concept that has been brought by the membership over the years. The blog at IPC, I want the listeners to know, ipc.com. Go to the blog section. Everything that we talked about today, the evolution of our pharmacy technician, how technology is being employed in the independent community pharmacy, how AI is impacting our community pharmacies. All of those subjects are accessible on the blog, and dig deeper into some of those discussions, all based on what works out in the real world, not just concepts by creative marketing people like myself, but the real grassroots. I love the blog, Mark. I love the efforts that you put in, because it's extremely sincere. It's true testimony to the power of the collective of people that are driving better care in their communities. And I'm proud that IPC is part of the Pharmacy Podcast Network. Thank you.
Thank you.
To close, Marc, I look forward for the opportunity for you and I to get together off the podcast and to continue this dialogue and continue to challenge creative ideas. Because here at Ural, we thrive on that, and look forward to doing that with you. And on that note, we'll say thank you very much for joining the Executive Dose.
Yeah. Thank you, Marc.
Thank you very much.